Hey YouTube, thank you so much for watching Mommy Did You Know? So for today's video, we're actually going to talk about breastfeeding barriers, how to correct a painful latch. I know that this is something that a lot of moms deal with. This segment is part of my breastfeeding and pumping video series. You can actually see it under playlists. So if you can hit that subscribe button, you can also check out the rest of the playlist for the rest of my class. That would be fantastic. So let's begin.
Mommy, did you know?
So for the first breastfeeding barrier that we're going to talk about, it's going to be how to correct a painful latch. I know that a lot of times moms, they'll come in, they'll start breastfeeding, you might have a little bit of soreness, but if the soreness continues throughout your breastfeeding session, or if you're getting cracks and blisters and bleeding, that can mean that we might need to tweak up your positioning a little bit. So I'm going to give you a very easy checklist that will help you to be able to have a more comfortable breastfeeding experience. So number one is to check your positioning. I know sometimes you'll have your baby all wrapped up in the blanket and you'll try to put the baby to the breast and the baby doesn't have a very good position, because you want to make sure that the position is tummy to tummy and also that the baby's skin to skin. That helps to get a nice wide open mouth and a nice deep latch, because that's really key, is to have a wide open mouth and a deep latch. So your positioning is very important. It helps the baby to be more comfortable, it helps mommy to be more comfortable, especially because sometimes your feeding sessions can last quite a bit. So an improper position can cause the baby to get anxious, they'll have a hard time latching on. So for the first step, it's always look at your baby's early feeding cues. I know sometimes people, they kind of wait until the baby starts crying and getting aggravated, but look at those early stages of hunger. Don't wait until the later stages. Earlier stages include REM eye movement. You'll start seeing their eyes move underneath their eyelids. You'll see the hand to mouth movements. You'll see sucking, lip smacking. Rooting is when they start moving their head back and forth, and sometimes they'll even start opening and closing their mouths. They're so cute like that. Late signs is when they start, moving frantically and crying. If you wait until that part of your baby's hunger process, that's usually a lot later, and then you have to calm them down before putting them to the breast, which of course it takes a little bit more time, effort, and it causes a lot of stress on us moms, So wait until those early feeding cues, not the late ones. You want to make sure that your position is tummy to tummy. Check the baby's diaper too. Sometimes if your diaper's full, it'll be kind of difficult to latch on. And of course, skin to skin. So that's number one. Check our positioning, put the baby skin to skin, check the diaper. And that latch process, just make sure that the latch is nice open wide, you have a nice deep latch, and make sure that you lose that latch halfway through the session too. I know sometimes you're breastfeeding, you get so calm, and then all of a sudden you start falling asleep, and then that baby loses the latch. And then I come in, and then the mom's kind of sleeping a little bit, and the baby's just going like little kisses. That will really cause a sore nipple for you, and I don't want that to happen to you. And another tip that you can do is just one of my tricks. You can actually compress the breast as the baby's eating, and that'll help with the milk flow. It'll help to kind of lessen the duration of the feed as well. And then to relieve pain and sore nipples, of course, breastfeeding is not easy in the beginning. So if you're having some soreness, what you can do is use nursing pads. Those are really helpful, just because what happens is make sure that you have soft nursing pads, because some nursing pads, if you put them on, the friction kind of hurts you a lot. You can also use the gel pads. Gel pads were like the only way that I was able to breastfeed in the beginning, just because the gel pads allows you to actually be able to put on clothes. What you can also do is you can actually express some of your colostrum, put it over the nipple and the areola, let it air dry for about 10-15 minutes. Not a lot of people realize that, but it's actually a really good tip, and I'm sure your significant other, baby's daddy, does not mind if you are out with everything. For just like 10-15 minutes usually is good. It has like a nice protective barrier, and your colostrum has healing properties, so it's really amazing how that happens. Of course, you can always use nipple creams as you need, but of course your colostrum is better. It doesn't have really all those products, but nipple creams work really well. I have some nipple creams and a bunch of engorgement and nipple pain supplies in my on my website, mommydidyouknow.com. You can see a whole bunch of different things. And then of course you can also pump. So like, let's say you have a really painful nipple on this side that started getting cracks and bleeding. What you can do is you can actually pump that side, put your baby to the other side until that side heals. And sometimes that says that helps a little bit. And then of course you can also schedule a visit with a lactation specialist. I just so happen to be a lactation counselor, and I do offer online as well as in-home consultations. So check out my website and you'll be able to definitely help you out with that.